Hey, we're here again with Dr. Brad from Summit Family Dental. And Dr. Brad, if I have to have dental implants, which I hope I don't, but if I ever do, what's the recovery process like for something like that?
Yeah, so dental implants, as far as post-operative pain, what we usually experience is most people don't feel pain at all. In fact, they're kind of surprised that they weren't in more pain than they were. Um, a lot of times, just over-the-counter pain medicine, Tylenol, ibuprofen does a great job for that. When an implant is placed, there's usually a good chance that some sutures were put in. You'll have to have those removed somewhere around the 2 to 3 to 4 week mark. It all depends on your dentist and when they want to take those out. But once the stitches come out, the healing process really speeds up, and pain is pretty low for, I would say the hardest part of the dental implant is when the tooth was extracted. That's usually the most discomfort that you'll have, but the actual implant placement itself, a lot of times there's not a lot of post-operative discomfort. But how to take care of your implant basically is just allow things to heal, let Mother Nature take its course. If you want to do a warm saltwater rinse, that's probably a good idea. We don't recommend brushing the actual implant itself. Let things heal. Try not to push the implant. Try not to touch it with your tongue. Try not to pull your cheek back and see what's going on in there. Just let things heal. The soft tissue will close up and heal up very fast, and then we need the bone to heal around the implant after that. And that's a little bit slower process, might be a couple weeks, couple months, but eventually once the implant's integrated, then the easy part of putting the crown or the tooth on the implant is the last step of the whole process.
So the whole timeline then, from the time I come and sit in the chair until I'm eating corn on the cob, what typically is that for everything?
It kind of depends on how the surgery went or how much bone you had, but generally a good rule of thumb is it's about 3 months before you actually have a tooth you can chew on.
Okay. Well, thanks for the insight, because that's a big procedure there. So you can see more videos like this if you wish at the Summit Family Dental website at summitsmilesiowa.com. And of course, if you like what you hear and you like seeing these folks and what they have to share, you might want to get your teeth checked out by them. So consider that as well. Thank you for joining us.